Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back to the show, COIQ listeners. On today's episode, I am very excited to have Dr. Joseph Kvedar on with us again today. Welcome to the show.
Hey, thanks, Roxy. It's great to be with you and your listeners.
Thank you. So before we get started, I know that your roles have changed quite a bit over the last few months. So kind of give our listeners just a little brief background on your experience with Connected Health, and then kind of touch on what are some of the new roles you're taking on these days.
Well, thanks so much for asking. So I, in the early 90s, had a bit of an epiphany. I'm a dermatologist by training, as you know, and at that time, I was studying as a research project the role of digital imaging in dermatology, and it fell into my consciousness or lap, or however you want to say it, that we were missing an opportunity to not have to always expect patients to come and see us in the office, that we could do things by technology. And I've chased that
20 years ago?
20 something years ago. Yeah, almost 30.
Wow.
And I chased that dream ever since. And for about 25 of those years, I had the privilege of leading those efforts at Partners Healthcare, the delivery system I work in, which frankly largely meant a lot of proof of concept work, a lot of working with innovative companies to help bring their products into the marketplace. We had a variety of things we did. And then a couple of years ago, the folks around me, the senior executives, and I decided that it was time to scale, and that I probably wasn't the right leader to scale it.
Okay.
That I was much more comfortable on the front end. So I'm now an advisor to that process, and it's going well, and I'm on call for them when they need me. They pull me into various discussions from time to time. But what's taking up my time now, which is incredibly exciting for me, is this opportunity, and it's 3 or 4 things that I'm doing. I'll delineate them in a moment, but they all have what the common theme of influencing adoption at the national level, which is like a gift for me. So the first one I've been doing for some time now, this is our 4th year, but it's been very, very productive, is co-chairing the AMA's Committee on Digital Reimbursement. A second one is working with the Association of American Medical Colleges to get telehealth baked into the training curriculum for medical students and residents, so that people who come out of training have some facility with this tool set.
Yep.
The third one is incoming president of the American Telemedicine Association. So that starts in just about a month. So we're changing our bylaws, and it's probably going to be a 2-year commitment. So that'll be a lot of fun. And then the fourth is I just took on the role of editor-in-chief at Nature's Digital Medicine Journal. And that's about building the evidence base, which is, of course, important as well. So that's a portfolio of fun things. It does give me, and they definitely overlap, and people will call me about one and I refer them to the other. So sure. It feels a great way for me to spend my time these days.
So you're bored is what you're trying to say. You have nothing to do.
Nothing to do, yeah. and all of it can be done from home, which is
right.
gratifying.
So obviously we have this absolutely horrific global pandemic that is happening before our very eyes. And that's really changed a lot of things for us. You and I spoke, I think it was probably about 7 or 8 weeks ago when I first got the email from you where you were, just letting your network know what were some of the new and exciting things on the horizon. And I remember being peppered in there with some of the things that you just mentioned about being dedicated to the adoption of telehealth. And we talked about having you on the show again and, just really kind of for our listeners, kind of encapsulating what was the state of telehealth. And I can tell you that a lot of the things that I would have asked you and that we would have talked about 7 weeks 7 weeks ago are very different. And so, I wonder, I mean, obviously, there's still a lot of work to do, but I wonder how the COVID crisis has served in the silver lining of this as a catalyst. And so I envisioned that you probably were thinking that this new mission of, national adoption of telehealth and, all things digital would take you 5-7 years to kind of start to make some progress. Do you feel like your mission's accomplished already?
No, but you're right. And you're a marketing person, so you know the value of getting a word into the lexicon. And the word telehealth is now in the lexicon in the US, and that is extraordinary. It just can't be said enough how that what seems to be little thing. I mean, I don't have to and never have to go to a cocktail party again when we start to go to them again, and tell people what that is. They will know. And that alone has been huge. I mean, it is those of us that are evangelists or leaders or whatever term you want, it is ours to lose now.
Yeah.
We can lose it, and you and I can talk more about that if you like. But no, it's been extraordinary, and for good reason. Not that I would have ever invented this awful crisis, but the fact that people, and it's interesting too, the other thing I'll just quickly mention is it's not just our industry. I hear little ads on the radio for financial planners saying we can do it by video conferencing. So
yeah,
everyone's sort of coming around to the fact that these tools exist. We still have, you said, would it take 5 to 7 years? Are we done? We're not done, but it's a different set of deliverables now than we had for sure 2 months ago.
So, let's talk about that. In my mind, there were, and you probably have a much deeper and broader perspective than I do, but in my mind, there were 3 things that were kind of acting as obstacles to telehealth adoption. And one of them was, legislature and regulatory, just physicians saying that, I want to see my patients in person, and patients saying that they wanted to see their doctors in person. And a lot of that has changed. So just kind of update us from your perspective. How has those 3 things changed in some fashion?
Well, the easiest one to talk about is the legal and regulatory piece. And so the government now, I can't speak to all 50 states. It's state by state, things can be different, but the federal government is now paying us at equal value of an office visit to do a phone visit, to do something that we would call an asynchronous visit, meaning you send me some information over the patient portal and I report back to you, or a video visit. So Medicare went that way. The governor of Massachusetts demanded that all payers do the same. That was about 3 weeks ago. So there's all of that, which is for the most part, and again, I'm so pleased. Most times I'm proud of my profession, and this is one of those times. Most doctors that aren't on the front lines are happily taking care of their patients in whatever way they can, and we'll figure out the billing later, right? But we have the green light to do this. One of the things you and I might want to talk about is whether that will stick and how much of it will stick. So maybe we'll come back to that, but. The other parts I think you raised are really fast. Oh, and I should mention, sorry, before I go on, is that state licensure laws are also loosening up in most states, not all, but in many states, governors have said, you know what, we're going to not worry about that. And then the third piece that bears mentioning is and people will want to know about this, but the use of tools like FaceTime and Skype is now allowed, which it wasn't some time ago. And the reason that's worth mentioning, is twofold. One is that it does make it so much easier for you and I to have any kind of interaction because we can choose the platform that suits us both. We don't have to make you sign up for something and download something. If you've already got FaceTime, you can use it. But the other part that comes up, and I want to just address this, again, we can come back to any of this, but I want to address this as the privacy side. All this talk about Zoom bombing and so forth.
Mm-hmm.
It turns out that for a healthcare interaction, um, it is extraordinarily rare that you would have your video hacked.
Yeah.
The part that we're still doing, and of course we care a lot about privacy, but the part that we're still doing and the way we always did is recording it in the electronic record, and that's very secure.
Mm-hmm.
So anyway, just to recap those three things, they're new reimbursement, relaxed reimbursement restrictions,
Yep.
relaxed licensure restrictions, and relaxed technology restrictions. So that just helps everyone not think too hard about it and reduces friction, as they say in the industry.
Yeah. So our company is virtual and has been for day one. So we've kind of, in a lot of ways, we're operating business as usual. And I've used Zoom. That's just been our, tool of choice for at least 5 to 7 years, probably about 8 hours a day. And I'm not saying it doesn't happen, but I've never had anything happen. Maybe a little unstable internet connection here and there,
Right.
but nothing like, what you're hearing about with the Zoom bombing. Yeah.
So just to finish that one off, and not to, again, I want to make sure that nobody who's listening to us thinks that I take it lightly. No one in my industry takes privacy lightly. We take it incredibly seriously.
Yep.
But when you have something like an AA meeting and you publicize on Facebook the link, that means anyone can dial in. That's really not hacking. That's just someone saw the link and they were nefarious in their intent. That's really not hacking. So just want to sort of put a good face on that.
Yeah, that's important.
When you talk about patients wanting to see doctor in person and doctors wanting to see patients in person, those are really insightful comments on your part. It speaks to the sociology of our culture. It speaks to our industry. And I would say a few things about that. One is that no one that I know of is suggesting that the office visit go away anytime soon, that the face-to-face interaction with a doctor disappears after this is all over. And I think one of the things, again, we could come back to is what is the likelihood that all this telehealth will just phase out? Right, we can come back to that. What will all those restrictions get restricted again?
Yeah.
But with that caveat, the answer to your question is people are finding out, and that's mostly doctors. I have to say most patients are pretty comfortable with this tool. But a lot of doctors are finding out that you can conduct care this way. Not all care.
Right.
It has to be high quality. We can't be sloppy. We can't say, well, it looks kind of like you have a sore throat there. Maybe we'll give you some Z-Pak. We can't mess up.
Mm-hmm. Mm-hmm.
But so much of, and what I've asked doctors to do when we talk about this, as I've said, think about, and this patients can do the same, but it's just as a doctor, you kind of know what information you need to make a decision. Think about those interactions you had with patients where you didn't need to touch the patient.
Mm-hmm.
Sometimes we touch people because it's part of our therapeutic armamentarium.
Right.
And again, that's great. And we mustn't suggest that goes away.
Yep.
But there are a lot of times and a lot of examples where it's really mostly about talking. Mental health, of course, can all be done this way.
Mm-hmm.
And check, like reviewing a lab test. So many of the conditions that we treat are related to lifestyle, high blood pressure, obesity, diabetes. Those can all be checked and with sensors remotely and reported out. So a lot of stuff we can do. We don't do procedures remotely yet. Probably won't in my lifetime. But when you think about it, it's really what I think is most exciting about this, to just finish off your long-winded answer to your question, is that it's required people to think differently.
Yeah.
We used to ask them to think differently. I got up in front of so many audiences in the 27 years I've been doing it and said, please just think differently. Just think differently. And people would go off and doctors rightfully go back to a waiting room full of patients and a 6-month wait. Why do they need to think differently?
Right.
So this has forced them to. And I dare say we won't go back all the way to just face-to-face. I'm almost certain of that. How far back and what, those are worth talking about, but we won't go back all to face-to-face.
Yeah, I definitely agree. I think that from what I'm hearing, anyone in my circle, and these are not physicians, these are, more friends and family that have had, virtual visits in some form or fashion over the last few weeks, they love it. And they're like, it was so convenient. It was so easy.
Right.
and again, it's kind of like, that's what you've been saying for 27 years.
Yeah. Well, we have a nice, I think, analogy. There's a program we've been doing for a couple of years out of Partners where I work called Partners Healthcare on Demand. It's a virtual urgent care program. Again, existed long before the virus. And for a small list of things, like sore throat, earache, uncomplicated urinary tract infection, there's a list of about a dozen things. We can get you a doctor on the phone, on the video within about 5 minutes. And 80% of the time, your problem gets answered. What's not to like about that, right?
Yeah.
So again, I think, of course, there will probably always be some patients who just want to come in. Yep. And they should be able to. And we shouldn't, again, in this time, this crisis, we can't. But in general, we should just bring them in.
Right.
There's nothing wrong with that. I enjoy seeing people in the office. Never faltered on that. But there's going to be a whole bunch more who are like, just what you said, like, man, give me the convenience.
Mm-hmm. Yeah.
And we'll be able to offer that.
So from an adoption standpoint, I'm curious your perspective when we think about the technology adoption curve and how that market is typically sliced, right? The innovators, early adopters, early majority, late majority. It seems as though that for years we have still been teetering in this innovator early adopter market, and we really haven't crossed that threshold, crossed that chasm into the early or late majority market. And it seems as though that the unfortunate circumstance of the virus has been the catalyst to help cross the chasm.
Mm-hmm. I
and
agree.
Push a really large segment up to the market into adoption. And I think, to your point, I think that there's going to be, besides the laggards, I think there's going to be a lot of people that are going to be like, yeah, this is great.
Right. Why didn't we do this before? Yeah.
Yeah. Absolutely.
No, I think we have. We've moved, in my opinion, I used to say we were somewhere between early adopter and early majority for years. And I think we've now pushed over. Again, sad that it took a crisis to do it, but never waste a good crisis, I guess. So
Right, exactly. That's a great quote. So let's talk about what's temporary versus permanent. And, it can be through the lens of telehealth, but it can also be through the lens of, any type of virtual care or remote monitoring or anything like that. We're definitely seeing a increase in adoption in a lot of those different areas or sub areas within digital health. What do you think is going to stick, and what do we need to do as an industry to help facilitate that more permanence once this is behind us? Because we all know we will get past this, right? We don't know when, but we know this will be behind us. And so I wonder if there's anything that we need to do now, kind of as a health innovation consortium, to try to assist that. So we don't just really unwind everything that we kind of accomplished during this window from an adoption standpoint.
Well, that could be a whole nother show. So we'll see if we can do this thing. I think so. Organizations, I mentioned that I'm incoming president of the American Telemedicine Association. Organizations like that have the platform to help bring together providers, vendors, policymakers, et cetera, and really speak with a common voice. And we're doing that now. It's going quite well. We've just had a very, for instance, we're in the conversations directly with the White House Task Force. We've been very, I think, effective, our policy people have, in getting some of these things done quickly. So not to sound self-serving, but join the ATA, because that's a really good organization to help move this stuff forward. We think we have a unique opportunity there.
Mm-hmm.
But also, in whatever capacity you as a participant in the ecosystem have to lobby your congressman, to speak to your senator, to talk to your local health plans. One of the things that I really want to see, and you mentioned, I'm so thankful to hear you say that your family and friends are pleased with their service level. I worry that because we're bringing so many new people on both sides of the platform, that we'll see service levels suffer.
Mm.
So those of you who had a good service level, tell your employer, tell your health plan,
Yeah.
we don't want this to go away.
Mm-hmm.
Employers listen to their employees, especially benefits people, and they in turn speak to health plans. So there's a very natural communication channel there that's like lobbying the government, but on the private side. So I think people should be very vocal about that. And so again, I think our danger zone here is that because we're bringing so many people on, as you pointed out, some of them reluctant,
Mm-hmm.
that we'll see some dips. I mean, it's great that your experience with Zoom has been so positive. I think during this crisis, all of the companies have had some lapses in their ability to get the technology to be perfect.
Sure.
And all the telehealth providers, I just saw a piece yesterday. I think it was published on Friday, and I believe it's in Becker's, on every single telehealth service provider seeing a big spike in demand.
Mm-hmm.
Well, guess what? Their networks don't grow exponentially overnight. So that means if you have something and you dial into one of them, Telehealth, American Well, MD Live, you might get a little longer wait. And that's, unfortunate, but it is because we're seeing this spike. So I think consumers, I'm telling everyone in the industry, lean in hard to give everyone a good experience.
Yeah.
And that they should feel cared for.
Mm-hmm.
It is healthcare. It's different. So if you're anywhere in that care provider or service provider ecosystem, just make sure the person feels cared for. Maybe they have to wait, maybe this, maybe that, but go out of the way to care for them. That'll help. And then at the end of it, people will say, like your family members, I don't want to go back.
Right.
And so then they in turn have to go to the various payers and regulators and sort of say that, hey, this is nonsense. We're not going back.
Mm-hmm. Yeah. Yep. Great wisdom. And I think that, to your point, we really, no matter what role we all have a role to play.
We do.
In some form or fashion.
We do.
Yeah, that makes sense.
Yeah, and that's right, because what was once a sort of curiosity or people would say, yeah, and I used to, again, I was saying this to you off camera, that I'm giving a couple of virtual talks coming up, and looking at my slides from 6 weeks ago, they all seem kind of quaint. But there are things like saying that we as an industry need to get to a point. This was a quote. I would say we need to go to a point where this is like your stethoscope. It isn't something that you look at as a curiosity or an option. Well, we've got to that point now. So now what, right? So I think the idea is making sure that we perfect the triage points.
Mm-hmm.
A lot of people, for instance, here's an interesting, I think, analogy. A lot of people are, and at least I'm told anecdotally, hospital systems are implementing a lot of these chatbots on the front end, because so much of screening for this virus is very algorithmic in nature. And you can do that with software. So making sure when you implement something like that, that the person interacting with that software can get to a person. Right? That you're not trapping them in some god-awful loop.
When you're like I want to speak to a human.
Yeah, right. And we can't do it that way. So it's thinking through things like that we
Yeah.
all, I think, have a role that, and if we do that, if we band together and make it, again, it's healthcare, make it feel that way, then I think we have an enormous opportunity for success.
Hey, it's Dr. Roxy here with a quick break from the conversation. Do you want your innovation to succeed, to change lives, to shape the future of healthcare? I want that for every health innovator, which is why I invented COIQ, an evidence-based framework to take your innovation from an idea to startup to full market adoption. If you're not sure where you are in the commercialization process, take the free assessment now at drroxy.com/score. Don't miss out on impacting more lives just because you have a low COIQ score. The free assessment is at drroxy.com/score. That's drroxie.com/SCORE. And now let's jump back into the conversation. So let's talk about, again, just kind of the broader scope of connected health, digital health, remote monitoring, and all of the health innovators that are out there right now. There's definitely some obvious things, but how do you think that health innovators are being impacted by COVID? What are some of the opportunities and what are some of the challenges that they're facing?
Yeah, great. No, that's a wonderful question, because I do hear from a lot of them. And then I hear from, because as I said at the top of our conversation, I'm no longer directly involved in day-to-day decision-making around purchasing. I can refer people. And so I would say a couple things. There's a theme. This is just sort of advice for take it or leave it, right?
Yeah.
I'm a guy who's done this for almost 30 years. I hear a lot, including companies that I advise, and I'm not so sure that's the wisest choice. So I hear a lot from people, we want to do something, we're going to create a COVID X, Y, and Z. And everyone in their heart of hearts wants to be part of the solution, and that's great.
Yep.
And it does bring out, people who are in business that are kind of, especially on the investor side, can be cold-hearted. It's bringing out the best in them. But with that said, if that thing that you want to create is a pivot for your company, that's not a good idea, because you're going to burn through capital. You're going to distract yourself. I think you're better off. Now, if for instance, Bowie Health is a company that's local here that does symptom checking. So for them to do a COVID symptom checker, it's right down the fairway.
Yep.
Right. So something like that. Great. Thank you.
Pivot.
Yeah. Thank you for that. And we appreciate it. But for a lot of people who come in and say, I think we could do X. If it's not within your normal project business plan, I wouldn't recommend it. It might make you feel good today, but boy, it'll take you off kilter. And as you know, and you've done so many of these sessions with so many interesting people, it takes a lot of effort to get this stuff right. So that's one thing. I think the other thing that is frustrating is that so many people now, and again, I get a lot of incoming, which I'm grateful for. I love to be something I didn't mention when you were asking me about my the hats that I wear is I'm a board member and advisor to a number of companies. So I love the commercial side.
Yeah.
So I do end up hearing from a lot of people. And what I have to say to them is, yes, you're right. You have the perfect X. But the people where I work, for instance, and I can really only speak most thoughtfully about them, they've already made the decision to ask why to do that. Even though your X is perfect, they've already decided to hire Y.
Yeah.
They can't stop what they're doing and vet what you have. They just can't. And that's sad. But it don't, think that you're going to make the usual 18-month sales cycle go down to 2 weeks. It's not, it's the opposite. Like they're shutting out people because they're focused on, okay, well, we made a decision to implement X. And, in the remote monitoring space, that's probably the hardest because there's so many interesting new patches or rings to wear or sensors or things like that, or things where you can hang up a sheet of what looks like a sheet of paper in the house and monitor people. Most of that's not getting any traction whatsoever. It either doesn't have FDA clearance or, it doesn't have a clear marketing path. You're the expert on that, the path to market. So I hear from a lot of those people and they're frustrated, and I'm sorry, and I don't blame them, because a lot of those innovations are exactly what we need, but it just, in a crisis, they're not going to go anywhere, unfortunately.
So, in my experience over the last few weeks and working with innovators it's been, there hasn't been really kind of, and you're alluding to this, like there hasn't been really like a cookie cutter response, that really analyzing that current strategy and what those different scenarios could be is where I think there's a lot of value. And I'm seeing anyone that can pivot, like the buoy example that you gave, it can pivot really within a couple of days, and it's really more of a micro pivot, right? They're not changing their business model, they're not changing their innovation, they're not going out and starting something new from scratch. It's just kind of reframing or retooling the solution to the highest priority and unmet need at that time. But what I'm seeing is that if there was a pipeline of relationships, that those customers there's a certain segment of the customers that are reaching out and going, hey, could you do this?
Yes.
And
yes.
that is really flourishing. So it was an existing kind of warm, it might not be a customer yet, but it was some kind of warm relationship that I'm seeing something that can come to fruition. But cold relationships, like you said, just doors closed, reach me after COVID and probably give me a 30-day window to recover.
But it's so you really nailed it. That's perfect. If you have a good relationship with someone, then yes, they're probably going to call you and say, I know you're innovative, are you working on this or that? It's not, though, just to reinforce kind of another way of looking at this, not the usual RFP process.
No.
Right. Those kind of things just aren't happening. It's like, we know Sam does this interesting patch that you can slap on people and monitor them in their home. Let's order, 1,000 of those from Sam. And that's done. That's, there's some thought that goes into it. It's not completely random, but it's not like, let's do an RFP that takes 6 weeks and then we do, we're not working that.
Right. No, not at all. Yeah. So what about the financing piece? What insights or exposure do you have to this? What about those health innovators that were, planning to participate in all those pitch competitions at the conferences, the last month or so, and it just got canceled, right? And, they just had high hopes of getting a bunch of, infusion of capital. And, what do they do now?
Yeah, I wish so maybe you can help me with that. I'll give you some just thoughts.
Yeah.
My own savings depleted by about 20% in 2 weeks.
Yeah.
So I've not been a prolific angel investor. I've made a couple of investments here and there. Not probably going to do that for a while.
Yeah.
Right. So and that I'm. Most people in that network of angels are probably feeling the same way, that whatever their end was, it's end minus 20% now. And that just feels small.
Yeah.
But it could be that it's hundreds of millions, but if it's 100 million less, that still feels small. So that's just a psychological thing, I think, in that space. The VCs, I think, for the most part, are looking at their portfolio companies and wanting to make sure that they help them get through it. So again, that means less new investment. They all, as you know, they leave money aside for people they invest in for things like this. So unless you're tanking and they were trying to get rid of you anyway, they're probably going to help you along.
Yep.
But again, that's not good news for someone who's looking for new funding. I think it's really challenging. And I don't really know PE. I'm on the board of one PE-owned company, and I don't have a good sense for that world, whether it's whether it's grinding to a halt or not, I assume like everyone else, they're seeing contraction of their capital, and therefore they're being a little more careful. But
Yeah. And so my experience with that is again kind of that it varies, right? It depends on what niche, what solution, what pivot, like what opportunities they have, and then also some just the psychological profile of that situation and those team members involved. Some people I think are really risk averse in general. And so they're just like, we need to just stop what we're doing and wait and see.
Yeah.
And then there's other people that are like, opportunity. And they're,
buy low and sell high, right?
right. Exactly. So I'm definitely seeing a mixture of the two.
I think it's, I'm a buy low, sell high type, but I don't have a lot right now of cash to buy things with unless I sell stuff. So it's just, yeah. I mean, it's a, and this is the term that's overused, and I'm going to use it anyways, unprecedented, but we just don't know how this market's going to turn out. It's just so extraordinary.
Yeah. Yeah. I don't think any of us can really predict how long or the end result of this.
I did hear something from, this is, secondhand. So if I get it wrong and someone listening knows, they can write us an email and correct me.
Yeah.
But I heard about a conference board prediction that we would see, and I won't probably get the numbers exactly right, but next quarter, so Q2, we'll see about an 8% drop. We've already seen a big drop in Q1, of course. And then it's going to rebound pretty quickly in the fall. That's what I'm told. So I love that. That's great. So, stay tuned.
I vote for that path too.
Right? I'm all about that. So we'll see.
Yeah.
Thank God we're not in the hospitality industry, right? I mean, goodness gracious.
Yeah, absolutely. So as we think about, those companies, remote monitoring companies, all of these different health innovators, do you have any, wisdom or guidance for them as they just try to survive this season? And it could be, I don't know.
I know, huh?
It is so unprecedented.
It depends on how you run your company and how you what you do with your capital, right? If you're capital efficient and you have capital, then perhaps this is an obvious thing, but I'd say work on your product, right? One of the things that I've always criticized that industry for is that the products are never easy enough for anybody. Never easy enough for the consumer, the patient, or the provider. So make something that's so easy that I don't have to think about it. Make it as easy as an iPad or as easy as that interface, right? That I can just pick it up and do it. Nobody's done that I'm aware of. And so I would say everyone should be working on that if they have capital and resources.
Yeah.
Maybe you're not out selling, but let's get the products better, because a lot of them are designed by engineers for engineers, right? They need to be designed for people who are afraid of technology. So
yeah, definitely.
That's one thought.
Yeah. So the other thing that comes to mind is, cultivating relationships right now. So there's definitely going to be those hospital administrators and frontline staff that we are just not getting in front of, and we shouldn't be getting in front of, right? We don't need to add one more burden or interruption to them. But I think, cultivating relationships of just championing them and supporting them and encouraging them and just being human, really, right? Because at the end of the day, we're just all people, just being human with other people and not selling anything right now.
Yeah. And I can't tell you how many offensive emails I get where people are like, "Hey, I saw your piece in the Boston Globe. We're selling this." I mean, it's like,
right.
You gotta be kidding me, really?
Yeah.
So the tyranny of the mass email to your inbox is even worse now, and it's almost offensive. So, yeah, I know you advise a lot of people on how to do marketing, but this is not the time to send everyone in your inbox a Dear X email. Oh
my goodness. I mean, I went from, let's say 500 emails a day to 1,500 emails a day. And every company that I didn't even know had my email address is emailing me to tell me what they're doing to keep their employees safe. And it's just really crazy.
Yeah.
Oh,
it's kind of amazing.
it is. So is there, as we talk about this, is there anything else on your heart or on your mind in the context of this discussion that we should talk about?
Well, I think we've covered a lot of it, but just to review, I think anyone in the supply, what I call the supplier side, meaning the tech companies or the telehealth companies or the remote monitoring companies or behavior change through apps, as I said, use the time to make your stuff more easy to use.
Yeah.
None of it is easy enough. And, one of the other things, I'll digress for a second, but one of the other things that was in my lexicon 6 weeks ago when I would give a talk, and for some reason, for the last couple of months, I was giving talks to doctor groups. I don't know why it just worked out that way, but was people would come up to me and say, okay, I'm all set. Now, what do I do? What can I do as a practitioner? If you're not part of a big system that uses Epic, or you're not part of, well, the answer is it's hard, because you can either sign up for American Well, which is not really what you had in mind, because you're going to do their cases.
Yeah.
There's and I don't know a lot about it, but there's a platform called doxy.me, doxy.me. Looks like it's not bad, right? Our docs are using it, some of them, and during the crisis, so we'll get a sense of it. But something like that, where I can just go in and sign up and let my patients know that I've got this. So we don't have enough of those. We definitely don't have enough of those. So those are things on the supplier side that people can be working on. As a patient, just keep taking notes of what you like and what you don't, because that should be, we should follow that. We are, when we peel it all back, we're a service provider industry, and we don't do enough of that. I've said that for years, but we should be listening to what people want. And if what you want is, you say, I want an in-person experience, we should peel back that onion and say, well, about what? What is it about that makes you feel that way? And maybe you had to wait a long time, or you had jagged video, or things that we can fix. As a clinician, keep thinking about, when do I actually need to have the person in front of me? What are those decision points where it really doesn't make sense for me to do it by technology? So those are three things I would say.
Yeah. So you touched on something that, we've had conversations. I actually did a session on this at the Connected Health Conference last year on co-creation.
Yes.
And so as I think about the Telemedicine Association's role, if I'm a consumer and I have some perspective on what I like and what I don't like, I'm probably going to tell my friends and family, but how do I get that in your hands or your organization's hands, so that way you guys could aggregate that feedback? And I see companies like Starbucks and Legoland and Procter & Gamble that do really incredible jobs on setting up web pages for that type of data collection, to continue with ideation, right? Like what you didn't like, but what would you like to see next, kind of thing. And so maybe that's something that we can do as an industry to help facilitate that more permanent nature, is to create that collection mechanism for all of that feedback, and then kind of packaging it in some kind of way where we know what to do with it next, so we can continue to serve and meet the industry's needs.
No, that's very insightful. I mean, I just reviewed a paper. I ended up suggesting the editors reject it, but it was on using Yelp reviews and so forth. I think, I would say this, as doctors, we've been largely passive, with one exception, which is the notion of patient-reported outcomes. So we're getting a lot of practices that will hand you a tablet when you walk in the waiting room, and you tell them some things about your experience. And of course, there's the age caps and on those standard surveys, which a lot of people are convinced are kind of not very meaningful. At any rate, I think you're onto something. Now at ATA, we are grappling at this point with how best to reach patients and consumers, recognizing, as you well know, that that's an enormously expensive proposition, and we're not an organization that has the kinds of resources that an American Heart or one of those bigger organizations has. So we have to think that through. And but I think you're onto something in terms of the repository, and especially if we could somehow use some natural language processing technology to codify it all.
Completely. Yeah. And, as a whole, if we really want to shape the future of healthcare and we want there to be some permanence behind these, small adoption increases that we've experienced here recently, then we kind of have a responsibility to come together, providers, vendors as a whole, and kind of pony up for the solution, because it will serve us well as a whole. If we come together and try to figure that out, it will be better suited than if one entity tried to take it on its own. Yeah.
One way to sort of summarize what we've been talking about is as an industry, because of this crisis, we threw a lot of spaghetti against the wall at once. And so as we see what sticks, we have to refine it, make sure that it's professionalized, make sure that it's not chaotic, make sure that it's well organized, make sure that it's thoughtful.
Yeah.
And then it will stick long term.
Yeah, absolutely. So, Joe, how do folks get a hold of you if anyone has any questions for you after watching and listening to you today?
So I'm on LinkedIn, Joe Kvedar, Kvedar. I'm on Twitter at jkvedar. You can email me. It's my first initial last name, jkvedar @partners.org. I also have a website, joekvedar.com, that has a lot about me on my website.
Excellent. Well, thank you so much for your time today. I thoroughly enjoyed our conversation.
Likewise. Look forward to spreading the word with you.
Thank you. Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.